Hey everyone, this is Michelle Cordero from Athlete Remedy, and I want to welcome you to today's episode. Thanks so much for being here with me today. If this is your first time, I'm so glad that you're here. I hope that you find the information that I shared today useful and helpful. Feel free to check out previous episodes as I go over a lot of different topics that will help you, especially if you're a young athlete or the parent of a young athlete, okay? So today we're going to be talking about heel pain in young athletes. This is a common injury or ailment that I see in my practice every single day. And also going to talk about Sever's disease. Now, you may or may not have heard that term before. Maybe your son or daughter has experienced that. But if not, I'm going to walk you through it today and explain why. So for today, I figured I'd bring my friend here. Don't mind Mr. Bones. He's lost a limb, his arm. But I wanted to kind of show you visually so you have an understanding of what heel pain can do, what kind of damage it can do, and why it hurts and what structures it affects. And then I'm going to explain to you what Sever's disease is because it is related. Now, in a previous episode a few days back, I discussed knee pain, and I talked about briefly what tendonitis was specifically related to the knee. And so if you haven't watched that, go ahead and check that out because I go over sort of the causes of tendonitis and what it is. And essentially I explain that it is inflammation of the tendon, right? So the ending itis indicates inflammation of that structure. So tendonitis is inflammation of the tendon. And this is no different. So heel pain will usually develop for a number of different reasons. And most likely it is usually linked to overuse, okay? If your child does a lot of different sports or trains a lot every single day during the week and does different activities, then they can certainly suffer from heel pain. And a lot of times it's just part of having, these growing pains and aches and pains, and they usually resolve with just, resting and taking a day off or applying some ice or doing a nice foot bath. But I want to talk specifically about those lingering pains that can lead to Sever's disease. So typically what happens is a young athlete will start to develop pain right at the bottom, foot, you can see here, right at the bottom here, right at the base of their arch or their heel. They might feel some pain on the outside or inside around the heel area. And this could come on suddenly, or it can gradually come on where they just start to complain about, my heels hurt. It might be one or both of them. And I would say immediately, within the first day or so of having this complaint, I would recommend soaking their feet in a warm Epsom salt bath, rolling out their arches with a lacrosse ball, and applying ice, on and off at least 2 or 3 times a day for about 15 to 20 minutes each time. Now, if this does not get rid of their pain and they are still complaining of this, I would say if your kid is complaining of heel pain for, I would say within a week to 10 days, that would set an alarm where I would recommend them going to get it further looked at. And the reason is that we want to make sure that he or she is not suffering from Sever's disease. So what is Sever's disease? So like I previously mentioned in the tendonitis video, specifically with the knee, I mentioned Osgood-Schlatter, which is a condition that develops due to repeated and chronic tendonitis in the knee. Well, similarly, at the heel, it's called Sever's disease. And all it is inflammation of the growth plate right in this area here of the heel. And the growth plate is simply an area that is in the bone that for developing children, there's still this open space because they're still growing and developing, and the bone has not reached maturation. And so the growth plate is that area where there's still growth expected, but it's still not closed. And so it tends to be a vulnerable part that can be subject to pain and irritation more than an adult, okay? And so I'm going to share my screen. Actually, before that, so just so you get a visual, so let's pretend that on my model here, if I can get this going, we've got, pretend this hair tie here is the muscle, right? So we have the Achilles tendon and the calf right here, okay? And it attaches from the back and underneath, okay? And now with the motion, there's obviously forces, okay, that are causing and pulling on the heel. In addition, we've got underneath the foot, right? We'll pretend this is the arch. That is also, with the movement of the foot and ankle, that is also creating a push and pull, excuse me, on the same part of the heel. To better understand this, I'm going to share my screen with you so you can maybe better see. Let's see if I can do this. Trying to figure this out. I don't know if I can do this right now. Okay. Not going to be able to share the screen right now, but that is essentially what happens. So what you have is you have the calf, okay? You've got the calf right here. The calf then becomes Achilles tendon, and that wraps around the heel like this. And then underneath, following the heel and into the foot, you have the arch. And so these are structures that are pulling on the heel both in that direction and in this direction. So that causes some irritation. And so what happens is that area can get swollen, can start to pull on it. Certainly if there's a lot of activity, it will start to hurt. And what you don't want to happen is, like I said, if this has been going on for, I would say, from between a week to 10 days that your child has been having pain, I would recommend going to get an x-ray, going to see an orthopedist about it, just to make sure that there is no damage to the growth plate, that there is no fracture there, because it can become very vulnerable. And so usually the treatment for this is ice. They might prescribe some anti-inflammatories, but most importantly, rest. And typically, depending on how severe it is, rest might mean 2 to 4 weeks, or it can take a couple of months, okay, depending on how severe the condition is and depending on the amount of activity that your child is doing. And I get it, nobody likes to miss practice, nobody likes to miss games, and nobody likes to be sitting out, especially due to injury. However, I have definitely seen that when this is not treated accordingly and the ample rest is not taken, it will develop into a more severe condition where you can get a full fracture of your foot, requiring surgery. You might get an Achilles tendon rupture, or you might develop plantar fasciitis, which is very debilitating. And now you're looking at long-term effects that will definitely affect the performance and participation of the young athlete, okay? So again, my recommendation is, if your son or daughter complains of heel pain, try to remedy it by using a lacrosse ball to roll out their arches, soaking their feet in a warm bath with Epsom salt, as well as applying ice 15 to 20 minutes about 2 to 3 times a day. And if this does not resolve within a week to 10 days and they're still complaining of this pain, then I would say make sure you go get evaluated by an orthopedic, again, to make sure that that growth plate is not affected. And again, resting or minimizing the amount of activity during the week is crucial for this to heal. So hopefully that has been helpful. If you have any questions, feel free to drop it in the comments or message me. I would also love to have you inside the private community of Athlete Remedy. I will leave a link below for you to join as I go more in depth there with my group. Share this if you found this helpful. Drop me a like and let me know any questions you might have about this topic or any other topic that you'd like for me to discuss. I do these live videos every single day, so I will see you tomorrow.